Hi, it's my pleasure to be joined now by Dr. Scott Pope. Dr. Pope, thanks for joining us today.
Thank you. Thanks for having me.
He's a new guest for me, so we're very excited here. Again, as you know, we are at Zero World in Orlando, Florida. What are your lecture topics here at Zero World?
I'm actually talking on sleep apnea. And I mean, this is actually probably one of the largest growing trends in dentistry. Over 30 million people suffer from sleep apnea, and actually less than 10% are even diagnosed with sleep apnea. And out of that percentage, only 2% are even treated.
So dentistry is on the front lines to treat this, right? I mean,
I think absolutely. I mean, we come in contact with our patients, I'd say, hopefully on average twice a year. If you look at a survey done with regards to physicians, less than 20% of physicians are screening their patients for sleep apnea or having that dialogue or conversation. So we're at an opportune point to be in contact with our patients and at least start the discussion. And whether that discussion starts with just a questionnaire that you have within your handouts that you give to your patient to fill in, or in our office we have a cone beam imaging system. So on that cone beam, anytime we take a picture, I'm always going to go look at the airway. And if I see a constriction there or a narrowed airway, I'm going to have that conversation with that patient.
So this is something that any dentist with a CBCT could be doing right now?
Absolutely. I think everybody that has a CBCT should be having that conversation with their patients because that's in their scope of treatment. I mean, we can see it.
And to me, I think it's one of the scariest diseases because it happens while you're sleeping, so how would you know? It's not something, oh, my tooth hurts, doc, you gotta help me, that's one thing, but something's happening while I'm sleeping and I don't know. I mean, how would I tell?
I mean, just the health effects that are a result of sleep apnea. I mean, it's life-threatening. It's a serious illness and something that we need to address. The public is just starting to become more aware of sleep apnea, so I think the more that we can do to educate our patients, I mean, we're providing, dentistry is a service, and that's, I think, should be in that scope of what we provide for our patients.
So for a dentist who might not be doing sleep apnea diagnoses yet or doesn't know where to begin, what would you tell them?
I would tell them, in all honesty, join one of the academies that that focuses on sleep apnea, like the American Academy of Dental Sleep Medicine. Mm-hmm. That is a great place to start. They have a huge resource of information for the doctor to basically kind of get them started, get them to understand what to look for. I mean, yes, I mean, there's a number of patients that kind of fall into that category of, overweight, neck circumference greater than 17 inches for a male, 15 for a female, or just being male alone puts you at a higher risk of having sleep apnea. So, I mean, just these things alone, you'll be surprised though that even if you think that, these people, that I should only be looking at the people that fall in those basic categories, it affects almost everybody, in truth. And we've treated patients that I would have sworn there's no way that this lady, 60-year-old lady who's a triathlete, could be suffering from sleep apnea. She's in the best shape of anybody I've ever seen, and yet she does have sleep apnea.
And there it is. So yeah, wow.
So you think, and in her situation, it's just a natural constriction of the airway. So it's just an anatomical feature. So it doesn't have to be related to other health issues or things that you may have. It can be strictly just an anatomical problem that you have to deal with.
So this is really something that dentists need to be getting on board with. And I think some are, but I'm sure there's always that percentage that is reluctant to, get on board with it.
Well, there's a lot of, I think, I wouldn't say roadblocks, but a lot of hurdles that I think dentists are thinking about. First of all, okay, if I get into sleep apnea, okay, where do I go for the best resources to learn how to do this? Mm-hmm. Second, okay, once I do that, well, where do I send the patient? Because they're going to need a sleep study, they're going to need a diagnosis. I recommend sending them back to either their primary care physician, develop a relationship with a sleep center near your office, or you can go look into home sleep studies. And that's something if you want to take on as a dentist yourself, you can give the patient. There's a lot of companies out there that you can just kind of do that handoff, and they can follow up with the patient, get the home sleep study done, and get the results back to you. I mean, the big purpose is being able to diagnose these patients, whether they have it or not. And if they do, then have that discussion, well, is CPAP going to be the right treatment for you? If so, fantastic. If not, guess what? In dentistry, we have another alternative. We have oral appliance therapy. And it actually is recommended, American Academy of Sleep Physicians are recommending that oral appliance therapy be the #1 treatment option for patients with mild to moderate sleep apnea. And even patients that are CPAP intolerant, that might be severe sleep apnea, it's the next line of treatment for these patients. So I don't know if you've ever seen what a CPAP machine looks like.
Yes, I have.
Try and imagine sleeping with one of those on.
Yeah.
I don't think I could do it. And I'm a scuba diver, and I'm just imagining if I go to bed with my scuba equipment on, I'm not going to sleep very well.
Yeah, that's what it would feel like. Yeah.
So being able to show them a small little appliance that that we can treat that sleep apnea with is, I think, a huge relief for patients.
It is, and I think some people are reluctant, as patients are reluctant to go get tested because they say, what if I do have it and I have to lug this machine with me everywhere? It's a life changer. It really is.
It is. Now for the patients that say do tolerate CPAP, well, then you have the conversation that I understand you have sleep apnea. I understand you have CPAP and it's working great. Fantastic. What do you do when you travel? Do you carry that thing with you? Or would you like us to make you an oral appliance that just use when you travel? Use the CPAP at home.
That's a great option.
I mean, it is. It is.
Option.
So while I'm here at Cero World, what I'm talking about with dentists is we've created a digital workflow with Sirona, CCAT, and CEREC to basically, from start to finish, be able to, one, co-diagnose with the patient where we see problems, be able to have that conversation, send them back to their primary care physician, their sleep center, or however to get that diagnosis. Once that diagnosis of sleep apnea is made, at that point we can then have the patient back in our office if they choose to do oral appliance therapy, have them back, take a scan with basically a George gauge that's been preset to where we think is going to be an ideal treatment position for that appliance. And when we take that image with that bite gauge in there, we can then see the changes in that airway. And if that airway is sufficiently open, or if there's still a constriction, we know right away. And we can talk to the patient about that, but it gives us a definitive starting point where we know that we're going to be a lot more successful. Because in the past, treating sleep apnea with an oral appliance, we would have to titrate. And what titration is you're guessing, and you're just going week by week or every other week with the patient, trying to find that sweet spot where that appliance is effective but not uncomfortable for them. Now we can already start in a position that we feel is probably about 80 to 90% in that zone of the sweet spot.
That's great.
And so it's much easier, much less titration with the patient, and I think we're getting much better results too.
Well, that's great to know that Dentsply Sirona can provide a full solution for everything that you need for this.
They're fantastic.
Well, we know they have solutions for everything, but specifically for this as an emerging treatment.
Oh, it is so smooth. I mean, I'm a dentist that also does implants, and so my surgical guide protocols and workflow are the same as my sleep apnea protocols, where I can take an image, input my CEREC data, and basically send it off to, digitally to have that appliance fabricated, and it's back in my office in 7 days.
Can't beat that.
Makes things pretty easy.
Well, thanks so much for taking the time to talk to us today. It was very enlightening, and good luck at the rest of Cero World.
Excellent. Thank you.
Thank you.